Hi, I'm Elizabeth Hess. I'm here with Julie Pryde, the administrator of the Champaign-Urbana Public Health District. Julie, let's just get right into it because vaccinations have been taking over all of the questions for the last 6 to 8 weeks. Who is getting vaccinated in this community right now?
Well, we're still having plenty of interest in vaccine. We've heard other counties are not. So we're thrilled that people are still actively trying to get this vaccine, and we're getting people in as fast as we can. We have so far done 105,851 vaccines in our county, probably another at least 10% vaccinated from other counties that work here but live around us. We have 26.63% of our county fully vaccinated. That's over 46,000 people. And we just keep doing it every week. Carl has it, Christie has it, OSF has it, and they're up in Rantoul. Walgreens and all the different pharmacies in town have it. And CUPHD has it. So we just continue on.
So as appointments become available around town, just jump on it because they still go in this county very quickly, correct?
Correct. But this is super important that people understand that if they're 65 and older and living in Champaign County, please contact us. Please contact us. We will get you in possibly this week. We're going to have a special clinic on Wednesday just for people 65 and older. So, reach out to us. If you know somebody that hasn't been vaccinated, reach out to us today and we will get them scheduled in.
If I could screen share right now, I would show you scenes from South Texas and Florida, Miami Beach this last week. Are you worried about a spike of people, spring breakers, coming back to this community after spending time in, I don't even know what to call that petri dish?
Yeah, well, petri dish is a good name for it. Unfortunately, it's a petri dish for the variants. So it's just, I was just super upset when I saw that. I understand that people want to have fun and they want to get out there and it's spring break. I get all that, but it is absolutely not worth taking the risk for. Vaccinations are here. People are getting vaccinated, and to go down there and put yourself and then your family and coworkers and friends at risk when you come back is, it's very irresponsible and it's very concerning. What we've told people in our county, if they go anywhere on vacation, on spring break, on anything, when they get back, even if they're vaccinated, please go out to the mall, to the drive-through clinic, and get tested as soon as you get back, even if you're vaccinated, because that helps us to be able to track any asymptomatic infection, because we still don't know if that can happen once vaccinated. So go out and get tested as soon as you get back, and then wait about 5 days and get tested again. And that would really help us out to be able to shut down any potential outbreaks before they really get going.
I'm glad you brought up the mall because some of the testing have slowed down and they are taking away 2 of the days. Can you talk about the hours of testing right now?
Yeah, they have closed down some of the hours. So the mall is still going 4 days a week. They're still open and they're still doing it. It's the same as always. It's free. It is accessible to everyone. And, we really encourage people to do that. I think that right now, not as many people are getting tested because we're not having that huge surge that we had earlier. And I know that we are absolutely going to see that huge surge in other areas, but I certainly hope we don't see it around here, because we do not want to go back to that space.
Do you have the numbers in front of you for where we are right now in our area?
I do. Right now we're at 246 active cases, 10 currently hospitalized, and unfortunately we've had 136 deaths.
Are you anticipating a week or two and waiting for spring break results? Is that kind of the window of where you're looking right now?
Yeah, so spring break and other people have been traveling. Again, if they're vaccinated and they're traveling, it's certainly not the concern that we're having. It's what we're concerned about are people, who aren't vaccinated, but no vaccinations here. Vaccination doesn't work magically. You have to get it, and then you have to get the second one if you're getting those types, and then you have to wait an additional 2 weeks. So, it's not foolproof, but you absolutely have to get it in before you're protected. So, I am worried a little bit about that. I'm glad that our numbers are starting out really low right now. So that helps a lot.
And the variant has not overwhelmed this community, correct?
Well, we have a lot of the variant. That's definitely, we're seeing that. and that's the B.1.1.7 variant. What's more concerning, especially when you see people gathering from all over the country in places like South Texas, South Florida, what will happen then is they'll be exposing each other, and there are multiple variants going around the country. And again, every time that it's transmitted from person to person, there is an opportunity for a variant to take hold that will be able to get past the vaccines. And we do not want that. We do not want to have to start all over again. And that could happen. So, right now we're in a race to see if we can get everybody vaccinated before the variants take hold, or mutate in such a way that we have a real problem. So, yeah, that was very disheartening to see that this weekend. But it's also disheartening to know that states are just acting like we are not still in a pandemic, and unfortunately we are, and we're still going to see deaths, and we're still going to see hospitals being overwhelmed because places just aren't doing what they're doing. And as hard as it is for everyone in Illinois, we are doing the right thing, and certainly in Champaign County we're doing the right thing, and people have been great about it, which is why our death rate is much lower than it is in a lot of other counties, because people are doing the hard work.
I do want to focus on the positive, and that is the number of adults that have gotten vaccinated in our area, which is amazing. But people with school-aged children, there's that but after it. Yes, we're vaccinated, all of the adults in our house. However, do you know if we're any closer to the trial phases and where we are with getting kids approved for vaccines?
Yeah, well, certainly Moderna right now is in trials with kids, and they're all moving toward that. So hopefully by fall we'll be able to see some of the results of those trials, and hopefully get kids vaccinated. But again, kids have been viewed, especially the younger kids, almost more like vectors than being so concerned about them. And although it's possible for a child to have a really bad case and have disability or death associated with it, it is really rare, especially compared to older people. So kids were really looked at as vectors of infecting older people who would have serious outcomes. So now that we know that the teachers are vaccinated and the grandparents are vaccinated and parents are getting vaccinated, that certainly makes it less of a concern.
Of course, far be it from me to question the CDC, but you are a parent and you spent time in schools. The difference between 3 feet and 6 feet, does it really matter? Now the CDC is saying that 3 feet's okay, but have you seen children interact in a classroom? Have you seen people sneeze and how far it goes? How do you feel about 3 versus 6 feet?
In the pandemic, as with any new infectious disease, things are, the science is evolving, and they're having lots and lots more data to look at. So I've got to believe that they have figured out, done some risk analysis and figured out that masked kids in 3 foot space is okay. We'll see. I certainly, and like I said, the real concern was more of them being like vectors to taking it home and stuff. So that is, well, we're just going to have to see with that one. I think that they obviously didn't just make that up. I mean, you always start by erring on the side of extreme caution and then moving, as you get more data and more information, moving, changing the guidance as we go. So that's what I'm guessing. That's where we're at. They can still keep the kids 3 feet apart, on all sides, and mask up. Again, masks are really crucial. They're really crucial.
When people argue with you about the efficacy of masks, do you just point out the fact that we literally had no influenza this year? There were a handful of cases in the US. People who spend the winter with the flu or sinus infections or strep, there was none of that. Is there? I mean, that's not just anecdotal, that you can just point to that, right?
Yeah, that is true. But honestly, if people are going to argue with me about the efficacy of masks, there's nothing I'm going to say that is going to influence them. So I don't even argue with them about it. There's plenty of science out there to prove that they absolutely work, and plenty of anecdotal, like you said, evidence that they absolutely work. I absolutely think that we're going to see people wearing masks from now on, especially people that are at risk, that once we get into that cold and flu and norovirus season and everything else, I can see hopefully people being more aware of the efficacy of mask wearing and staying back away from people, when they're sick, because, and even when they're not sick, because we can tell people to stay home, but again, a lot of things transmit before you even know you have it. So it was very clear that the masks worked and the hand washing worked very well, which we've also seen a lot less norovirus and things like that. So people are paying attention, and they need to understand that these are just very basic public health measures that they can do all the time.
Last question before I let you go. Long before the pandemic was something you and I talked about weekly, we talked about other things that you always bring up in the spring, such as seasonal allergies, mosquito season and all of the issues there. Tick season is around the corner. The public health district is continuing these things around the corner. What do you want to say about some of those things that are outside of the pandemic realm, which still exist?
Yeah, they still exist, and we'll still be talking about them and sending out information and press releases and doing surveillance on mosquitoes and birds, and working with their partners at U of I on ticks, and yeah, all those things are still there, and it's all preventable. So we'll be encouraging the insect repellent with DEET and those type of things, and you'll be hearing the pandemic isn't going to keep tornadoes away. You'll be hearing information on that, and information on flooding and everything. So life goes on outside of the pandemic as well. So all of our services continue. They're all going, and we're still getting occasional cases of other infectious diseases that we have to follow up on.
Great. I didn't want people to lose sight of the fact that your office is focused on hundreds of other things back behind the scenes as well.
Yeah,
Julie,
we're still doing it. We're still working.
I don't know what this community would do without you. Julie Pryde, administrator of the Champaign-Urbana Public Health District. I want to thank Jason Liggett. Jason, you are the best. You're our producer. UPTV has really great programming. Check it out. The really random, wonderful community outreach on UPTV. And of course, Urbana Mayor Diane Marlin, thank you so much for letting us continue to get the information out. Julie, I will see you next week.
I will see you next week. Have a great one.